Hey guys, so today we're doing part 4 in our series about debunking myths in the pharmaceutical industry. And today's myth, pharma companies are not well regulated. That's actually a big old myth. Pharma companies are absolutely regulated and actually heavily regulated. Then something changed in the last 10 to 15 years, and that's something that's called the Pharma Code. And that's something that you are going to learn about in this video. It's actually really important because the Pharma Code, which is PhRMA, stands for the Pharmaceutical Manufacturers Association. It's actually a trade organization for the pharma industry. They enacted this code, and this code basically regulates how the pharma industry engages physicians. The government really pushed the industry towards enacting this code. Here's the trick though. That code is not required. It's actually a voluntary code. It's a voluntary code. So the pharma companies really kind of regulating themselves. Pharma companies, as you're going to learn, they have a lot of lobbyists, they have a lot of power in Washington, they wield a lot of influence. And so it's not surprising that pharmaceutical companies can actually work with the government and can kind of convince them, let us regulate ourselves, we can take care of it. Another law, for example, that was enacted is the Physician Payment Sunshine Act. Now, the Sunshine Act actually looks at the idea that pharmaceutical companies need to disclose how much money they're giving physicians. That could be giving them money because they're consultants, because they're involved in clinical trials, for any old thing. And physicians' information is then disclosed to the public. It says Dr. So-and-so has received X amount of dollars from this pharmaceutical company. And the idea behind that is simple. It's that we want to make sure that physicians don't have a conflict of interest. They're not prescribing products and also getting a lot of money from the drug company. Maybe that's influencing their prescribing and they're not doing the best they can. Now, one area that's been left kind of not touched, if you will, is medical affairs. And so medical affairs is the function in the pharma industry that's educating physicians. These are people typically called Medical Science Liaisons. And the truth is, there really is no competency standards for medical science liaisons. And in full disclosure, I'm the founder of the ACMA. I've mentioned this before, the Accreditation Council for Medical Affairs, and we actually developed the first ever competency standard. So I know a thing or two about this, and we'll definitely talk about this in another video, but it's really important because these are like the stealth secret force by pharma companies that go out and educate doctors. It's not the sales rep, as you might think. You're going to learn more about that in upcoming videos. Make sure you like us, follow us as well, and make sure you comment below. I'd love to hear your thoughts. I'll talk to you next time.